Good morning from Madrid, from European Society of Cardiology. I'm with very good friend, Dr. Jayne Morgan, very known cardiologist in USA. And I just want to ask you, what's for you the best trial in this European Society of Cardiology?
You know, Dr. Bennett, since I've been here, what has struck me the most is the information that we have on women's health and what we're talking about here regarding women's health. Not just the dearth of information, but what has happened to clinical trials all the way from the 60s when we had the thalidomide situation to the 90s when we had the Women's Health Initiative that sort of shut down hormone use, and how women have just been excluded. And we have been practicing medicine, extrapolating data from men, applying it to women, really to the detriment of both men and women. What's interesting is we're looking at beta blockers now, and it turns out that there may be some beta blockers that actually are more detrimental to women than men, that are actually causing harm, causing heart attacks, and we've got to actually stop practicing medicine this way. We must get information not only on women, but on all populations, and stop practicing medicine where we get information on a narrow demographic and then we extrapolate it to all other populations. So I've been very focused on all of these women's health topics. All of the lectures that we've had here today, they've been really, really, really incredible. I'm heartened to see that we're increasing enrollment for women in heart failure trials finally, but we have a long, long, long way to go because biologically men and women are different, and we need to address that, especially during the time of pregnancy. Lots of emphasis in this program on pregnancy and in our guidelines, American Heart Association guidelines as well, but also more emphasis on menopause.
In America, how is the heart of women? Is there any advice, is there any, how do you see the heart women in America, in States? How does this problem?
Yeah, this is a huge problem. In the United States, it's a huge problem really globally, that we just don't have the information that we need for women to actually treat them, to actually address the biologic differences as a woman ages, but even as she is born and begins to mature and grow. And women or men are not the same, but we don't have that information. We have only information on men. We know medications work or don't work on men. And what happens with women, we have post-approval information where we start to report adverse events and report side effects. That's when we gather information on women when it goes out into the real world environment, and that's not safe for women, that's not safe for science, and we can really do better.
Thank you very much, Dr. Jayne.
Oh, Dr. Bennett, it's a pleasure.
Thank you. Thanks.